First, can you just tell me what the date is today?
February 16th, 1996.
And where are we right now?
We're at the University of Michigan, Department of Neurology.
And what's your full name?
John Joseph Wald.
Can you tell me who's the president?
Bill Clinton.
And who was president before him?
George Bush.
Can you just repeat after me? We all went over there together.
We all went over there together.
No ifs, ands, or buts.
No ifs, ands, or buts.
Each football game brought the quarterback closer to the championship.
Each football game brought the quarterback closer to the championship.
I'm just going to give you a math problem. Suppose you went to the store to buy 6 pieces of candy, and they cost 12 cents each. How much change would you get from $1?
28 cents.
Good. What is 100 minus 13 divided by 3?
29.
Good. These will seem like silly questions, but if a lion was killed by a tiger, which one is still alive?
The tiger is still alive.
Is my aunt's uncle a man or a woman?
He's a man.
What do an apple and an orange have in common?
They are fruits.
What do a basketball and a grapefruit have in common?
They're round or spheres.
What do a tent and a cabin have in common?
They're shelter.
What do a painting and a symphony have in common?
They're works of art.
Okay, good. I heard resonance all throughout, and that is what I wanted to hear. I'm going to percuss. I'm going to start in the right lower quadrant, upper right quadrant, upper left quadrant, and lower left quadrant. Okay, I heard general timpani around your stomach and dullness up in your liver and spleen, so that's what I wanted to hear. Start with your brachial. Relax for me. Good. Good. Now we're going to do your tricep. Relax for me. Good. And relax for me. Good. Now we're going to do your patellar. Good. Good. And now we're going to do your Achilles. Good. All of your deep tendon reflexes were a good 2+.
Let's check your reflexes here now. We did biceps, brachioradialis, triceps, biceps, that's brachioradialis and triceps. That's why I never stand in front of anybody when I do this one. Okay, there you go. Good, +2 equal and active reflexes.
Lift your leg up and just let me take the weight completely of your leg. Okay, thank you. And just the same on this leg. Okay. Can I just ask you to put your leg in a similar position as we had before, just with your knee out and your ankle, just like that. Okay, and just the same on the other side. If you're struggling to elicit any of the tendon reflexes because the patient is having difficulty relaxing, you can use Jendrassic's manoeuvre. What this is, Andy, when I try and hit your tendon with a tendon hammer, what I'd like you to do is you can put your hands together like this, and when I tell you if you can pull at the same time. Is that okay with you?
Yeah, that's fine.
You can put your hands like that for me. Okay, and just stay nice and relaxed and just let pull.
First, identify the biceps tendon. You can feel this in the antecubital fossa. It's a little bit to the medial side. If you're not sure where it is, have the patient contract their biceps, make a muscle, good, relax. That you can feel the ropey tendon shorten when this muscle contracts. Have the patient relax their arm, place your finger on the biceps tendon, and strike your finger. Note the muscle shorten and the forearm flexes. Alternatively, you can have the patient rest their left arm in your left arm and put your thumb on the biceps tendon and strike your thumb. It's a normal reflex. Note the bicep shortens and the forearm flexes. The same thing would be done for the right side. Upper motor neuron dysfunction causes hyperreflexia. In this case, the patient has had a stroke. Technique for identifying the biceps tendon is the same as for the normal side. It's in the antecubital fossa, the medial aspect. Ask the patient to flex their arm, okay, and relax. Now, flexion is impaired because of the stroke and the upper motor neuron dysfunction. The arm is rested. Strike your finger. You'll see how brisk the reflexes are. The arm flexes and the muscle contracts. If we compare that to the normal side, again, same technique. Strike the biceps tendon and observe the forearm and the biceps muscle. You can see that the forearm flexes and the muscle shortens, but it's nowhere near as pronounced as the other side. Hyperreflexia can be demonstrated in the patellar reflex. In this case, the patient has suffered a stroke affecting the left side of the brain. The patellar tendon extends from below the patella, which is right here. It's a broad band of tissue. It's easily palpable. If you're not sure where it is, have the patient extend their leg, which will cause the tendon to shorten. And you can strike directly on the tendon. And thus reflexes are very brisk. And in fact, there are a few extra beats of movement, which are referred to as clonus. Again, classic for an upper motor neuron syndrome. In cases like this, the reflex can be elicited by simply tapping on the tendon often. So you see the same reflex requires very little stimulus. Compared again with the normal side, patella tendon, again extending from below the patella. Strike on the tendon. So that would be a normal reflex and certainly diminished compared with the side that's hyperreflexic. Patellar reflex. The patellar tendon extends from below the patella, which is the kneecap. Roughly, it's a broad band of tissue that's right in this region. If you're not sure, have the patient extend their leg, and you can feel the tendon shorten and relax. And you can either strike your finger or just strike in the region. Notice that the leg will extend, the lower leg.
Yeah, we're going to look at the reflexes now. He's quiet. Get his leg into semi-flexion, and that's a good knee jerk. Do the same thing over here. See a normal symmetric response. And look at the ankle jerk. Another way to do this is actually just tap on the bottom of the foot, and he has a good ankle jerk there. And we just tap over here. Okay. Good biceps. It's very hard to get a triceps on a baby because there's more flexion tone, and so it's hard to get the triceps, and so we can try that, but we usually don't get much of a triceps, so we don't get much of a triceps there.
And I'm going to try to elicit the biceps reflex here on this side by hitting my own thumb. And there's the reflex. On this side, I'll turn my hand over. If I'm standing in front of somebody, I'll turn my hand over, put my thumb here. You don't have to help me, just relax completely. And I'll hit my own thumb. I don't know if you can appreciate seeing that reflex. I can feel it. Often in young people, particularly young men who have big muscles, The reflex can be dampened somewhat, but you can virtually always get it. There's the biceps reflex. Now for the triceps, you can actually cheat a little bit because the tendon of the triceps is way down here and the muscle is up there. So in fact, you don't really have to put your finger over the triceps. A lot of people do, just to remind themselves and to remind others that you should not hit the muscle directly. And you can do that by putting your thumb here over the biceps tendon and your second finger over the triceps tendon, and then just hit each of them sequentially to bring out the reflex. And you can see that triceps reflex, I think, very nicely. It's easy to, you can cheat a little on this one, drop it like a dead weight, you say to the patient, just relax, let me hold the limb, and you can hit it right there and get the reflex. You all see that reflex happening? There it is. And I'm not hitting the muscle directly, I'm hitting the tendon, so that's a real muscle stretch reflex. If you want to be really a purist, you put your fingers over the tendon, hit the tendon. But with this reflex, you can also cheat a little bit, grab the fingers like this, drop it like a dead weight, and sort of crawl up the brachioradialis tendon until you get the reflex. And there it is. You see it? So that's the brachioradialis reflex, a nice average reflex. Biceps, triceps, brachioradialis. Let's see what they look like. It's a nice average quadriceps reflex. You all see that? You don't have to worry about putting your finger here because remember the quadriceps muscle is above the patella and the tendon is below the patella, so no problem doing that without having to... Now you notice when I do it, don't grab the hammer way up here and sort of hit like this. Have a terrible time getting the reflex. Let it swing. You don't have to hit it hard. Let the hammer do the work. That's what's nice about these nice Babinski hammers. And you come down here, and again, I don't have to put my finger over that tendon. Tendon's way down there near the heel, and the muscle is way up here. But you can see that takes the foot right off the ground. It's got a nice average reflex. Let's see what that quadriceps reflex looks like. Give it a good pull. And you can see that makes the reflex bigger. If you let your jaw hang open, let me tap. He doesn't have a jaw jerk, a reflex when I tap his jaw. I think all these have a similar meaning. Tap on one side, tap on the other side. We don't see any of those. In many old people, you do. If you tap around the face jerks, jumps, moves, puckers, and yet the person is otherwise a normal person.
We're checking the individual nerves now coming out of the spine. And so far, orthopedically and neurologically, he is grossly intact. Relax that in my hand, just drop it. Oh, there's a problem. Now slide back on the table for me a little bit. There you go. Look up near. Your patellar reflex is really low on both sides. Now you've had patellar tendon repair over here, right? They had to reattach your left patellar tendon. You got a little bit of reflex on this right side. Got a little better ankle jerk reflex. Okay.
C5 reflex is basically around the bicep tendon. We can use our thumb to find the tendon. If you're not sure where it is, ask your patient to flex the elbow and you can find the tendon, and what you can do is relax. I can put my thumb onto the tendon. I need to change the shape of the tendon. Okay, and also place it onto slightly into a relax, just relax down. Just let them relax against you. So that is a little contracture if you want in the tendon, even though it's now relaxed. Now, with my thumb on the tendon, I am going to just tap my thumb, and there is a reflex, and you can see I'm just going to just change the angle of that one. So from there, I'm going to tap my thumb, and you can see there is movement of the bicep when my thumb is tapped. You can, for some patients, literally just tap there, and you can also notice a reflex. So you don't have to use your thumb all the time. That would be known as 2 pluses, and that would indicate a normal reflex for the left C5, which is the nerve root of C5, which is the disc between C4 and C5. Now, when we test C6, if I ask you to flex your elbow, please. This is the brachioradialis, all the way down to the radial styloid process. Be careful tapping the tendon because it's normally tender to tap for the patient. If you just tap somewhere in the belly of a muscle, you can see there is a slight reflex of the wrist, and also you might notice a reflex of the elbow. Some patients might pronate, some patients might supinate, depending on the position. You can use your thumb if you want to, and you can tap the thumb. I find it easier just to tap somewhere in the belly, and I tap it like that, and you can see a reflex. So again, C6 reflex is 2 pluses. C7, the easiest way I find is to bring the arm across the body, find the tendon of the olecranon insertion point here, the tricep. So the tricep comes in to the olecranon, and then be careful on pressure here, and then tap, and you can see a reflex within the tricep belly, and that is elicited through the C7 nerve root, okay, which is between C6 and C7 disc. So that would be 2 pluses for C5, 6 and 7. The next two we're going to focus on is L4. We're going to bend the knee slightly. You can use the thumb over the patellar tendon if you want to. You don't have to tap it. You can literally just bend the knee slightly and then tap, and you can see the reflex. So this is L4 test, and again that is a 2 plus. And the last one, which is an S1, you can do this in 2 ways. Bring the leg across your leg, dorsiflex the foot, so you place it onto stretch. From here, tap the tendon, and this is elicited through the S1. And the last one we can do is we bring the ball of the foot up, and then we tap the tendon, as in the ball of the foot here, we tap, and you can see the reflex is very good, and that would also be a 2 plus.
Okay, just relax your arm and hand right here in mine. I'm checking his upper reflexes now. This is biceps, that's C6. Brachioradialis, C7. Triceps, C7. Brachioradialis is also C6 too. C6 and 7, yep. Oh, there's a problem right there. Yeah. Okay, scoot back on the table just a little bit where your legs are hanging. There we go. Good. That's why I never stand in front of people when I do these. There we go. Good. Okay.
There we go. Go ahead and bend slightly. Good. Tricep reflex intact, noted by contraction of the tricep muscle. Again on this side. Good. Tricep muscle of the left arm intact, noted by contraction of the tricep. And then we're just going to check your bicep here. Good. Bicep reflex intact, noted by flexion and contraction of the bicep muscle. Check your left arm here. Good. Left bicep muscle intact, noted by contraction and reflex of the bicep muscle. Good. Popliteal reflex felt, indicated by flexion of the lower leg, and again. Good. Popliteal reflex intact, indicated by flexion of the lower extremity on the left leg as well. Going to check the ankle here. Good. Achilles tendon intact.
Then next I'm going to check your reflexes.
Okay.
I promise you I will not hurt you.
Okay.
Okay, so let's start up here. That's bicep. Okay. And then right here. Good. And then we will do your brachioradial. Great. And then on this side, your bicep. Good. And then your tricep. Great. And brachioradial. Great. That is good. Then I'm going to check your reflexes. Right below your patella, this is your patella reflex. Great. And then on the other side. Good. And then we'll check your Achilles. Just hold your leg. Great. And on the other side. And good. I'm going to look under your feet. Good. I do not see any lesions there. And I'll check for a reflex called Babinski. And that is good. Your toes are not flaring. Okay. And then on the other side, your feet looks good. And great. So all your reflexes are intact.
I do biceps, brachioradialis, triceps,
knee and ankle. When I do the ankle, I slightly dorsiflex the foot to get a better reflex. I grade deep tendon reflexes from 0 to 4, 0 being absent reflex, 1 is decreased reflex, 2 is normal, 3 is hyperreflexia, 4 is clonus. Now we'll do the pathological reflexes. The best way to do Babinski is use a semi-sharp object and go along the outer aspect of the foot to the ball of the toes.
Ever have your reflexes taken and wonder what the heck the doctor's doing or the physical therapist is doing? Reflexes provide some information about your nervous system. The muscles that we tap with a hammer, the tendons that we tap with a hammer, give some sensory information back to your spinal cord. Your spinal cord sends some information back to the muscle and makes it activate. So it gives us some information about the integrity of that loop of the nervous system, depending on what muscle we're tapping. So if we get information out of the quadriceps muscle, we get some information about that particular loop. If we do it in different tendons, we get different information about different nervous system levels. So it's part of our assessment. If you've ever wondered why you're getting your tendons tapped with a hammer, it's because we're looking for information about your nervous system, and it gives us some information as to where to go from there, depending on what we find. So now you know.
Now, when we test in the reflexes of a lower, L4, we test S1, and there is an L5. It's a struggle to get it, but there is one we can use on the hamstrings, but I'll show you that shortly. When I test L4, I'm going to bend my patient's knee, find the patellar tendon, or the ligamentum patelli, as it's medically known as here. I tend to hold the hammer with my finger or thumb, and then find the tendon and just tap. And then you can see there is a response within the quadricep. That would be known as 2 pluses, and then that would be a normal response. If I could not get a response, then I could call it a 1 plus, or maybe even a 0 in terms of a reflex testing. So to me, that will be testing the L4 reflex. Now, S1 we can do in a couple of ways. If I bend the knee and bring a leg in this position, find the Achilles tendon, we have to pre-stretch the tissue here because it works on the stretch reflex. So for instance, in this case, the Achilles tendon, which is the gastrocnemius, part of the muscle, which is via the tibial nerve, which is part of the sciatic nerve, but is innervated mainly by the S1 nerve root. So if you have a problem between, say, L5 or S1 disc area, and then the S1 nerve root is affected, and then you might find that this reflex is going to be diminished. If I dorsiflex your foot and use 2 fingers on the plantar surface, and then using the hammer, I'm in this position, and then around the Achilles tendon here, so I'm going to literally tap, and you can see there is a plantar flexion response. Watch again. Not so good. Let me just change the angle. And again. So that would be a 2 plus. Now, I can also elicit a response. So this is, you've got the medial and lateral plantar nerve here. So if I use 2 fingers and dorsiflex, and then I tap in somewhere in the ball of the foot, you can also see a response of the plantar flexion. So that would be a 2 plus response, which is normal. For the L5, if I get you to have a line in front, please. Remember, I've been testing the right leg, but it's probably easier for the demonstration if I use the left leg. Now, if I bend the knee, and if I ask you to flex the knee, please. So we find the semitendinosus will go to the pes anserinus area, so semimembranosus. So if I let the leg just relax on me, like this, let go, and if I come over onto the semitendinosus. I'm going to use my thumb in this case. And then I'm going to come onto the tendon and just apply pressure so I change the shape. And then I'm going to use my finger on a patella hammer. And I'm going to tap my thumb. And you can see there was a response. So this is the hamstring, and it's mainly coming from L5. So watch that one again. So on my thumb. And you can see that is a contracture within the muscle. So again, that would be a 2+ grid for the L5 reflex.
So now I'm just going to do some percussion around. I'm just listening for resonance throughout your lungs. Good. Good. And the next thing I'm going to do is test the diaphragmatic excursion, which is basically how much your lung is expanding each time you take a deep breath in and out. Should be between 3 to 5 centimeters. So I'm going to have you just take a deep breath in and hold it, and I'll let you know when you can breathe again. Okay, you can breathe. Breathe easy for a little bit here. Okay, and now the next one, I want you to take a deep breath in and then out and blow it all out like you're blowing on a birthday candle, and just hold it out. Oh, and you can breathe out again, or breathe in again. Good. And it should be tympanic over the spleen as well, and dull over the liver. And it is tympanic over the spleen. That would indicate that it's not enlarged. Have you ever had mono before?
No.
Okay. Now it's dull over by the liver. And tympanic again. Which is exactly what we're looking for. Okay, now I'm going to measure your liver span. I'm going to start at the right midclavicular line and go down. And then I'm going to do the mid-sternal line and go down. And there's the top of it. Work it with my pen here. And that's, I'm listening for a change to dull, indicating that's the top of the liver. It should be dull down. I'm listening for a change to tympany. There's the change right there. And that's about 8 centimeters, which is good. It should be between 6 and 12.
Okay.
And now I'm going to go mid-sternal and see. And there's the change there. Alright, and this should be between 4 and 8 centimeters, which you're at 5, so that is good. Okay, I think we can move on to testing your reflexes. So I'm going to first do, I'll do your Babinski reflex, which will be on the bottom of your foot. Okay, and I could see that your toes went down, which is what they're supposed to do. Alright, I'm going to test your biceps, triceps, brachial, radial, and your Achilles as well. So let's start with your biceps on this side. Have you flex your bicep here? Good. All right, thank you. Okay. Good. I can see your bicep reflex there. Contract. I'll do triceps. Let's hang your arm loose. I could see your arm move out, which is what I'm looking for. And your brachioradial. Okay, and I could see your elbow flex and your arm pronate, which is exactly what the brachioradial reflex should do. Okay. And then, might put the bed up a little bit here so your foot isn't dragging. Now I'm going to test your patellar. Good, and I could see your leg move out. And I could see it on that one too. Now I'm going to test the Achilles. And I can see your calf contract. And there too.
Could you, when I say 1, 2, 3, after 3, could you grit your teeth like this? Okay. So 1, 2, 3. Good, okay. And relax. So just try without that. Okay, good. Well done. Now, do you think you'll be able to bend this knee out slightly and put this foot on that leg? And bend that to the side. That's a bit difficult, don't worry, that's fine. Just relax your leg down. We'll do it like this instead. I'm just going to test your ankle once. So bend it a little bit. Good. Good. Relax. Same with this one, so we'll bend that tiny bit. Good. Well done.
So we'll see if she has that super strong stretch reflex, right? Yep. In fact, let's get a recording of that. Yeah, kind of off the charts there. Yep. He's a really big one. Okay.
For the biceps reflex, semiflex the elbow and place modest pressure with your thumb on the biceps tendon. This is located in the medial part of the elbow crease. When you have tensed the tendon, strike your own thumb. Now move behind the elbow for the triceps reflex. Take care not to strike over the medial aspect of the olecranon in case you hit the sensitive and occasionally exposed ulnar nerve. Place your fingers or thumb on the distal part of the radius just above the styloid process and strike your own fingers. These may be elicited either in the sitting position. For the knee reflex, fully support the weight of the semiflexed knee and strike the patellar ligament between the patella and the tibial tuberosity. In all positions, you will need to dorsiflex the foot, thus placing a stretch on the Achilles tendon and calf muscles. Ensure that at all times the patient remains passive by not trying to assist you. In the lying position, rotate the hip externally and slightly flex the knee, thus exposing the Achilles tendon. Dorsiflex the ankle and strike the Achilles tendon directly. The other method in this position involves placing a stretch through the Achilles tendon by dorsiflexing the patient's foot, then striking your own fingers. Test the ankle reflex in the sitting position, dorsiflex the ankle, and then strike the Achilles tendon from behind. The ankle reflex is supplied by the medial popliteal nerve, mostly from S1 and S2. Position your finger over the mandible and strike it. An exaggerated jaw reflex may be associated with suprapontine lesion.
Just place your hand on the patient's thigh, then you'll find the patellar tendon right here, and then just with a brief swinging and recoil motion, just like that. Just like that. just like that.
Now I'm going to do your reflexes, your deep tendon reflexes. I'm going to start with your bicep. So if you'll just relax your arm. Good. I'll get you to do your arm back this way. Good. All right. Let's do this one. We're going to do this brachial. Relax your arm out. Good. Out to the side. Good. We're going to check your forearm. You'll just rest your arm on mine. Relax your arm. Bend your elbow for me. There you go. Good. Relax your arm. Perfect. We're going to do your patellar. Good. Good. Okay. Now I'm going to get you to actually put your knees on this table just like this, because I'm going to check your Achilles. Okay. So if you'll just sit up on your knees right there. Perfect. I'm going to hit you right here on the back of your foot. Good. Good.
Can you see that, horsey? Does that look like a horse? Yeah, that looks like a horse. Do you know what this horse does? This horse goes tap, tap, tap. Oh, tap, tap. And he's going to go. And he's going to go tap over here.
Remember, that's what doctors do?
Okay. And then go. He's going to go.
The horse is going to get you.
Watch, he's going to tap right on my thumb. Okay.
Okay.
Oh, did he tap right there? Did he tap right there? And did he tap right there?
Good.
And did he tap right there?
Thank you.
Yeah.
Can you say thank you?
Yeah. See the horsey? Horses are like that.
Ooh, I want the horsey.
Isn't that fun? Okay.
I'm going to check your biceps first. So just relax your arm here for me. Good. Just relax. Biceps are 2+. Now I'm going to check triceps. Let me hold the weight of your arm. Just relax. Perfect. Just relax. Let me hold your arm. Perfect. Let me check your patellar reflexes. Uncross for me. Perfect. 2+ on the right leg. 2 breaths on the left leg. Now I'm going to check your Achilles. Perfect. And again, 2+ on the Achilles. Reflexes are normal.
It must be in neutral position to provoke the correct tendon response. And finally, strike the tendon in a single, brisk stroke and note the muscle reaction. You will get surprised when you see how a tendon reflects the action when you strike direct into them.
I'm going to go ahead and test your reflexes, all right? Just place your hands, just try to relax them if you can, okay? And we'll do bicep and tricep, brachioradialis, okay, the other side, bicep, tricep, brachioradialis, good. Now we'll do the patellar leg. Good. And Achilles. And finally, Babinski's. Good.
So we use a tendon hammer. For the knee, you want to bend the knee to about 30 degrees. Put your arm underneath like this to support it. Use the hammer, hold the hammer at the end to get the best swing with it. You can see both reflexes are elicited there. The ankle's quite tricky. You have to bend the knee out to the side. You can see him wiggling the foot there. What he's trying to do is relax the anterior tibialis tendon, which allows the calf muscle to contract. You can see the calf muscle contracting in both of these instances. It's about timing, that one. If the patient's not very mobile and they can't bend their knee like that, this is an alternative way. Essentially, you have to hit it as hard as...
I'm also going to do the biceps reflex by putting my hand on the biceps tendon, and then I'm going to strike my thumb, and I will feel the contraction as well as perhaps see the muscle contract. I think one important caveat is that it's important to keep your eye glued on the muscle and not so much focused on the movement, because if it's a very depressed reflex, all you might see is a contraction of the muscle. That level is C5-6 again for the biceps. I'll now do the triceps, which you could do many ways. If he's relaxed this way, I could just choose to leave his arm in the position it is, and I'm actually getting a good reflex in this fashion, so I probably wouldn't proceed further. But I could also suspend the arm like this, instruct the patient to lean on my hand as though leaning on a railing, and the measure of the hand being relaxed is that the forearm is loose. And then once again, strike the triceps tendon, and this is a 6, 7, 8 reflex, a higher level than the biceps 5, 6. If people are hyperreflexic, you can often elicit a finger flexion reflex. It's only significant if it's present on one side and not on the other. The patient's hand is very relaxed and it's supported by his thigh. I'm simply inserting my finger in there and asking him to just relax and leave his fingers the way they are. I tap on my fingers and you can see the brisk movement of his fingers. This is a finger flexion reflex. Its significance is only if it's absent on one side and present on the other. We're going to do the brachioradialis reflex. It's important to tap on the tendon and not the muscle, and to look at the muscle for contraction rather than looking for the movement. So even though there's a nice brisk movement, you see the muscle contracting as well. I'm then going to do the biceps reflex. I put my hand on the biceps tendon and I tap on my thumb, keep my eyes glued on the muscle. Both these reflexes, the tricep, the biceps and the brachioradialis, are C5-6. In the same position, I can also do the triceps reflex. As the patient is nicely relaxed, I'm going to strike over the triceps tendon and look for the contraction of the triceps muscle. And I see a contraction. You might or might not see a movement of the arm. The ankle reflex in a patient who's seated like this can be a little tricky, and if it's not a very brisk reflex, you might conclude that it's not there. I would make sure that the foot is loose, put a little bit of tension on the muscle, but not too much, and then strike over the Achilles tendon, and I can both see a contraction and see the resultant movement. This is S1 level. This is a great example of how this hammer gives you a great advantage over a little Taylor hammer. I'm now going to move up to the knee reflex, and again with the patient sitting like this and very relaxed, it's quite easy to hit the patellar tendon and notice a nice brisk contraction of the quadriceps muscle. Again, be sure to expose the muscle you're looking at. Keep your eyes glued on the muscle. Don't worry about the movement, especially the vastus medialis, which is the last thing to go when you lose the knee reflex. The ankle reflex in a bedridden patient is a little more tricky, and there's a couple ways you can do it, but it's easy to conclude that the reflex is not there when it actually is, and your technique impeded you from getting it. One way to do it is to simply make a bar with your two fingers across the metatarsal heads and cock the foot up just a tad. Keep your eyes on the muscle, and in this case you can actually see a nice brisk contraction just by this. Yet another way to do it is if the patient is mobile and has fairly loose joints, you can outwardly rotate the hip, flex the knee a tad, again put a little bit of tension on the tendon, keep your eye glued on the muscle, don't worry about the movement, the muscle is what we want to see, and we see a very nice contraction. This is again S1. Yet another way, which is useful in someone who doesn't relax very well, is to take the foot you're examining and cross the upper 1/3 of the foot you're testing over the lower 1/3 of the other foot. And the great beauty of this method is that if you get them positioned successfully, the patient cannot keep their foot taut. It winds up being a great position because they are unable to contract their foot. And now I put a little bit of tension there, eyes glued on the muscle, and we see a very nice contraction. This is the ankle reflex. It's S1.
All right, and the last thing I'm going to do is your deep tendon reflexes. I'm going to start with your brachial. All right, that's intact. All right, that's intact. And now I'm going to go down to your knees. All right. Okay, and those are intact.
Next, I'm going to do your deep tendon reflexes. I'm going to do your brachial. I'm going to relax your arm for me. Okay, that's good. Your tricep. Okay, that's good. Next arm. Next arm. Good. Gonna do your patellar. And both of your knees. And your Achilles. Okay, good. I'm going to also check reflexes, and we'll start down here since the camera's already down here. I'm going to do her knee with patellar reflex. Just relax your round legs for me. Good. And then on the Achilles, just relax your hand in my foot here, or your foot in my hand here. Good. Good. And let me bring this back up a little for you. Okay. And then I'm also going to check her brachioradial reflex here. Good. Good.
Now I'm going to check your reflexes. So I'm going to start with your brachioradialis for C5, C4, or sorry, C5, C6. So just put all the weight on me and relax, okay? Okay. And now for the biceps, put all the weight on my arm and relax. Okay. And that was for C5, C6 as well. And the triceps for C6, C7, C8. Good. And then we'll do this side. So the brachioradialis, just relax and put all the weight on me. Good. For C5, C6, and then the biceps, there you go, put all the weight on me. Okay, for C5, C6. Good. And triceps for C6, C7, and C8. Good. Now I'm going to do the patellar for L2, L3, and L4. Okay, and Achilles for S1, S2. Okay, and then the plantar for S1, S2, L4, and L5. Alright, and the patellar over here, so L2, L3, L4, and Achilles, S1, S2. Okay, and plantar for S1, S2, L3, L4, and L5. Okay.
Do some of your reflexes, so I need you to relax your arm on top of mine. Okay. Good. Same thing. Test a few more reflexes. Just relax your leg for me. Good.
So next thing we're going to do is check her reflexes. Just relax it right in my hand. Good. Good reflex there on the right biceps. Good reflex on the brachioradialis and good reflex on the triceps. Now this is the problem arm, so we'll see if this one's different. Much lower reflex. On that side it's +2 equal and active. That was a good one, and that was a good one. So she does have a C6 nerve problem here.
Now I'm going to test reflexes. I'm going to start with the biceps. And again, just let your arm just rest right there. The triceps. And let me just support your wrists and the brachioradialis. And over here. Again, just relax. Biceps, the triceps. Let me just support your wrist. The brachioradialis. Good. Okay, just let your fingers rest against my fingers. And we're going to test the same thing over here. Okay, good. We're now going to test reflexes and start with the knee jerk. Just relax totally. And compare to the other side. Good. And we're going to now test the ankle jerks. Just relax, just totally relax. Position it. Good. And we're going to try the other side. Again, just totally relax. Very good. We're now going to do the plantar reflex. Well, just hold still. Try not to pull back. Just relax as much as you can. Going to go down the lateral aspect of the foot and then across the ball of the foot. Very good. We're going to do it over here on this side. Same thing. Just relax. Okay, there you go. Very good.
The biceps tendon can be localized in the antecubital space, and it dives medially here. And the way you localize this is you can feel and have the patient flex their arm, and you should feel the tendon itself pop up right in this area. Push firmly with your thumb or your finger right over the tendon, and you're using the small point of the reflex hammer to strike your own finger, and you should see flexion of the arm and contraction of the biceps muscle. If you're having trouble with this, it's important to make sure that you're localizing the tendon properly. Press firmly over the tendon with your finger and strike firmly over the actual bone of your finger. So the brachioradialis reflex can also be elicited from this position. So the target to strike with the flat end of the reflex hammer is a few inches proximal to the distal radius, just overlying the radius. And this one can be very difficult to elicit. So if you have them extend their thumb like that, and you should feel the muscle and the tendon pop up. And you just strike right over the radius, and you should see a slight flexion of the arm, often seen as kind of a flicker of the thumb. Another way to do it is similar to the biceps reflex, is to firmly place your finger over the area of the tendon and then strike your finger. And you should see a flicker of the hand there. The triceps tendon extends from the triceps on the posterior arm and then inserts over the olecranon. So the best way to localize this is to just feel the proximal borders of the olecranon, and you can have the patient extend their arm, and you should feel the triceps muscle and the tendon move there. Localize the tendon, and then use the small point of the hammer. You strike that, and you should see contraction of the triceps muscle as well as extension of the arm. Alternatively, another way to do this is to have the patient's arm totally limp so that you're taking all the weight, and you're striking in the same area again, so just proximal to the olecranon, and you should see extension of the arm and contraction of the triceps. Use the small point of the reflex hammer to strike the tendon, and you should see extension of the knee and contraction of the quadriceps muscles. It's often useful to keep your hand on the patella itself to make sure you're not striking the bone, as this can be uncomfortable for the patient. The Achilles tendon extends from the gastrocnemius and soleus muscles of the calf posteriorly over the ankle and inserts on the calcaneus of the heel bone. To localize the tendon and the target for the reflex, you can feel the bony borders of the calcaneus, and just proximal to this you should feel the tendon itself. And to make sure you're in the right spot, you can ask the patient to plantar flex his foot and you should feel this tendon move. So to actually elicit this reflex, you want to have the patient totally relax his leg, and you apply slight dorsiflexion with your hand. And then using the flat end of the reflex hammer, you strike the tendon, and you should feel and see plantar flexion of the foot as well as contraction of the calf muscles. A possible normal variant in elderly patients especially is to have a reduced or even absent Achilles reflex. One simple but very common reason why some students have difficulty eliciting the responses is that they're simply not striking hard enough. So it's important that you practice the actual swing to make sure that you're actually causing sufficient stretch of the tendon to elicit the reflex arc. Another very common reason why sometimes it's hard to get good response is that the patient is not fully relaxed. And you can use a technique called reinforcement to help the patient relax and get a better reflex response. If you're getting reflexes in the lower extremities, one way to do this is to ask the patient to clasp both hands like this and then pull while you're eliciting the response. So they're having kind of an isotonic contraction of the upper extremities while you get a reflex in the lower extremities. If you're testing in the upper extremities, one common way to do this is to ask them just to clench their jaw as you try to get a reflex. So could you please clench your jaw for me? And it distracts and helps relax these muscles so you can get a good response that way.
Reflexes in the arms. Just give me all your weight. There you go. Not super duper reactive, but relax your fingers. Draw something in this hand. Tell me what I'm drawing.
3.
Something over here. Relax for me. Some reflexes aren't super duper brisk, but is that normal for you?
I don't know.
Okay. Same thing. I'm going to draw something in this hand. It's a number.
1. 7.
Correct. Close enough. 1, 7. Similar structures. Okay, uncross the legs for me. Go. Binsky.
So we're going to start in the seated position. It's really important that we fine-tune the tension of the tendon to really get that stretch reflex that we're trying to screen with reflex testing. So we're screening for the L3, L4 segments by doing the patella tendon. So I'm going to find that point between the tibial tuberosity and the inferior aspect of the patella. I want to make sure that I hit that spot. So I'm going to use my technique here, and I'm going to flick. And it doesn't have to be a lot. Okay, now, if we're not getting a reflex, what we can do is we can play with the tension of the patella tendon by manipulating the position of the knee. So if I just take that knee into a little bit of extension, so go ahead and totally relax for me, just be totally dead there, good. And then just let yourself relax on my leg, good. And I'm going to now do the same thing again. You can see how we just got a little bit better of a response by manipulating the tension of the patella tendon, okay? If it's too much tension on it, for example, right, it's harder to get that reflex. So play with that, okay? I like being on this side so that I can play with the position of the knee, okay? I'm going to switch sides to try the other side, okay? Excuse me, I'm not gonna do that. You're gonna stay on this side to test both sides, especially if you're a righty. Okay, if I need to play with the position, again, I can either use my hand, okay, now I'm a righty, so I actually switch sides to test the patella reflex, the Achilles reflex, excuse me. So I'm gonna come over here, I'm going to play with the position of the foot to bias the tension on the Achilles tendon. And notice the flick of the finger and the wrist. Good response there and here. Now a little trick, if you're not getting a good response at the Achilles, okay, we can lay her down. Go ahead and lay on your stomach there. Okay. On your back, excuse me. Okay. I'm going to come up like this. Okay. I'm going to create a little bit of a hugging of her knee in my armpit here. And then what I'm going to do is I'm going to basically use the smaller surface area of the reflex hammer, and I'm going to hit right at the head of the 5th and 4th metatarsals to see if I can get a better response. And you can see how I can get a better response there. That's if the Achilles response isn't getting you what you want. So here, I'm going to bias that tension here, and I'm going to, and you can get a response. Now, if we have a really acute lower back and they're more comfortable in supine, I actually may test them in supine, the reflexes that is, the dermatomes, the myotomes, so that they're not uncomfortable sitting, especially if we have flexion intolerant back pain. So in that case, this is how I would test these. So go ahead and come around the table. This is how I would test the reflexes in supine. So go ahead and scoot back for me. Okay, again, so to play with the tension of the patella tendon here, I can use my thigh or I can use a foam roller, see what I get for a response here. And I'm just feeling the quad for its response. And again, notice the technique. It's really important to, so that's all I need. I just need to see, can I get a response? And I'm comparing left and right side to see if we have a diminished reflex, if we have a hyper reflex. You see this one's a little bit more reactive. If you're more comfortable switching sides, that's great. If you want to stay on the same side, you can as well. But just so you can see the different variations of how to test, I can also test the reflex here. She actually gets a better response when I flex the knee and hip. So bias that tension. Okay, so that's the quick reflexes for the lower quarter.
And we'll start with biceps reflex. I tense the tendon and obtain that reflex. So C5-6 reflex, brachioradialis, more C6, triceps C7. They're often mixed a little bit, 6 and 8 in there. And I'll work down patellar reflex, L2, 3, 4, probably more 3, 4. Achilles, primarily 1, maybe some adjacent roots as well. Then I'll do plantar response, looking for that Babinski response. Hers is normal. Check clonus with an abrupt pull-up of the foot. And I'm looking for 1 or 2 beats is normal. You get into the 4 to 6 or sustained category, then that's abnormal.
You can check your reflexes here. So just relax your arm. Great. Okay. 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 And usually I would compare bilaterally for this exam, but for sake of time, I'm just going to do one side.
Okay. Please swap over. Okay. And again, raise your thumb for me. And relax your hand. Completely relax. Okay. That's great. So we can do the same here as well. Just press down. Just relax for me. Okay. We'll check the other side. Just relax it. Okay, great. And now what I want you to do, just give me the full weight of this hand. Just completely relax your hand. Completely relax. Okay, that's great. completely relax. Let me take the full weight. Just going to lift this leg up. Okay, if you just relax your feet completely. Just going to tap down the hammer. Okay, and the same on the other side. If you just relax your legs for me, let me take the full weight. Relax your foot. What I want you to do is just bend this knee for me. And you just rest this leg down this way. There we go. Right. Relax. I'm just going to push your foot up, okay? It shouldn't be painful at all. If it is, let me know. Just completely relax. Let's try that one again. Relax. If you just relax your feet for me, and tap just on your heel. That's great. Relax that leg for me. We can do the same with this leg. So again, bend your knee, rest it towards the side. Okay. Again, I'm just going to move your foot up. It shouldn't be painful at all.
Okay.
Just relax your leg for me. Try that again. Okay. Just going to check for the reflexes. So, get this up. Just going to tap on the back here. Okay. That's great. If you can just straighten your legs for me. I'm just going to check the reflexes underneath your feet.
Okay, just relax your arm in my hand here. Biceps is fine. Brachioradialis is fine. Triceps is fine. Oop, there's a problem. Just relax this for me. There we go. We like to have fun in here too. There we go. Now your left reflexes weren't as good as your right ones. Just let your legs hang. Got a little bit of a reflex on the right patellar and a loss of the left patellar reflex in comparison. Feel that one jump a little bit, and that one just barely does anything. So relax your foot. Let me hold it. This is the Achilles reflex. Just relax this foot. Okay, a very low reflex on that as well.
And we'll go ahead and test your deep tendon reflexes. So I just want you to relax the best you can here. Just kind of let your arms flip like this. Good. Biceps. Good. And relax. Brachioradialis. Good. And triceps, this one you really got to hang on my arm here. Just really relax. Good. Good. On the other side. Good. Now your patellar reflex. Just relax. There you go. And Achilles, relax. Now I'm going to test your Babinski. This might be a little uncomfortable, okay? Let me try that again. Okay. I'm going to test ankle conus.
And I have them flex their fingers just a little bit, not too much. I stick my fingers inside theirs and I tap my hand. Can you see her finger flexing? It's probably more prominent on this side, but this is not. This is a more pathological reflex. I'm going to have you open your mouth. I'm sorry. I won't hammer. I'm going to hammer my thumb. So I'm going to have you open your mouth all the way. Now close it halfway and just relax. I'm going to be tapping my thumb. You can't feel this, but I can feel a slight reflex. In a pseudobulbar patient, it will click shut on you. And in someone with bulbar palsy, like motor neuron disease, nothing will happen. My thumb is on there. My eyes are glued on the muscle. I don't really care what happens here. I mean, I do, but let's not lose sight that we're looking for a muscle contraction. So I'm seeing a nice contraction. I'm feeling it. I'm actually seeing something we call recruitment. I'm seeing the phenomenon of recruitment. She has some finger flexion. She actually has some other associated movements. Compare that to her other side. And again, what level is this, may I ask you? C5, 6, thank you. So compare that to the other side. Pretty brisk. A little bit of finger flexion, but nowhere as striking as on the other side. So she could probably have a pectoralis reflex. I can feel the pectoral contracting. You can see more recruitment taking place. We'll also do the brachioradialis. Again, it's useful to have them just relax. It's the same level. I'm aiming for the brachioradialis tendon. And there's recruitment, and there's a fairly brisk pronation too. So both of these are C5, 6, and then the triceps. So the triceps, again, you can just take the patient as you find them. She's quite relaxed now. I don't need to move her around. I just need to maybe get behind her. I'm not sure you're going to see this, but I'll come to the other side. This is on this side. I can see the muscle contracting and I can feel it. One more time. And I compare that to this side. If you didn't want to do it this way, you could also have the patient put their hand over you and just tell them, pretend you're leaning on a fence post. Pretend you're leaning on my arm. I'm a fence post. And you can do it this way. Again, the movement is nice, but we're really looking for the muscle contraction. This is C7, 8. So we did biceps, brachioradialis, and triceps. And now I'm moving to the knee reflex, and she's sitting comfortably. Again, no real need to position her in any way or do anything. It helps to find that she's dangling her feet. That's good. If they were on something, we'd probably want to take it off. And students, we actually teach them to feel the patellar tendon, but most of us by now can find it just by sight. And again, it's a matter of orienting your body, very much like in surgery. You can't always get to the other side of the table, but you can sort of get your arms to be on the other side. So you just orient your body into whatever position it needs to be to get the reflex. You all see that? I'm now going to lay her down and focus on the ankle, because as we mentioned, that is the metaphor for what we're going to do. Make sure they're relaxed by doing this number. If they don't flop down on the bed, then they're not relaxed. And then this is a nice way to compare one to the other, side by side. And I think you'll agree there's a little more hyperreflexia on this side. And she probably will have a adductor reflex, a hamstring reflex, but we're not going to get into all those. Just focusing on the ankle, we have a couple of ways of doing this. When they're hyperactive, there's actually a fairly easy way to do the ankle reflex, which is to put two fingers like a bar against the metatarsal heads and just push the ankle back a bit. I'm watching the muscle. I see it contract and I also feel it push. I don't teach this much because this is actually unlikely to be positive unless you, if you're lucky. But if you don't get it this way, I don't think you should give up. But the best way to do it is to use the leg on the other side to support you. So there's several ways of doing this. One is take the leg you're testing and cross it over so that the lower 1/3 of the leg you're testing is resting over the upper 1/3 of the other leg. And the beauty of this position is that when you do this, the forefoot becomes so floppy. You see that? They can't keep it stiff. Then I put a little bit of tension on it, eyes glued on the muscle. That's one way of doing it. Another way of doing it is simply to, if the patient's as flexible as she is, externally rotate the hip, flex the knee, and now the leg is resting very comfortably on the bed. Put a little bit of tension, watch the muscle. Again, a very nice reflex. A third way I see in some books, which always looks clumsy to me, but it might be your favorite method, I don't know, is you put the leg like so. It's balancing on the heel. You're putting a little bit of tension on the ankle, and
Good. Now we're going to check his reflexes. In his right biceps first. Good. Brachioradialis, good. And triceps is good. Those are all +2 equal and active, which is normal. Good. Biceps, good. Brachioradialis, and good triceps. And there you got good patellas. Now you know why I don't ever stand out in front of people when I do those. There we go. Good. That's it. So he's got good Achilles reflexes as well.
So what we're going to do next is your reflexes. You can just relax for this. It's not bad. Ready? Okay. Relax your hand. I'm just going to hold it. Okay. All right. Again, relax. I'm just going to hold it. Okay. On this side. All right, perfect. Your reflexes are there.
So next thing we're going to do, we're going to tap on your reflexes, okay? This feels kind of funny and weird. So, okay, here we go. Just let everything go loose. Okay, we're going to tap up above your elbow here. Okay, same thing here. Let it relax. All right, and we're going to tap here by your wrist. And here. And now we're going to move to your legs. We're going to tap by your knees. All right, let everything go loose. Great reflex. They're all present and symmetrical. And we're going to tap by your ankle here. I'm just going to turn your leg out a little bit. You're great. Terrific. Okay, and on the left. Just let it go loose. Let me do all the work. Excellent. Okay. And I'm just going to scrape the bottom of your foot a little bit with my stick here. Here it comes. Hang on. All right.
We're going to do tendon reflexes with the reflex hammer now. Okay? All right. All right. So first thing we'll do is go ahead and check here in this area, your brachial. All right. I'm going to actually tap my finger. See if you know. All right. Try one more time. Okay. Good. All right. Do your tricep now too in this area. So you hold your arm there. Very good. And, all right. Very good. Check this area as well. Okay. All right. Good. All right. Move to the other side. Do the arm as well. Brachial again. Very good. Okay. And have you push your arm out again like that. Myself that time. All right. Okay. So this time, well, we'll have you sit on that side of the bed, dangle your legs over the edge.
Okay.
All right. Just relax them, okay?
Okay.
There. Okay, good. Very good. All right. We're going to tap on the back of your ankle as well now. It's just your Achilles. Good. Other side. Just staying relaxed. All right.
So, that's his biceps reflex, and you probably saw that. Now watch his fingers and hands here. Excellent reflexes there. And we got a good triceps reflex. So we're seeing on this one that the C6, C7, and C8 nerves are all doing very well. Oh, there's a problem. No reflex there. Alright, see, we like to have fun doing this stuff too. Now, he's got good patellar reflexes. That's why I don't stand out in front of the patients when I do this. I did this on an elderly Medicare patient one time, and I was standing in front right after I got out of chiropractic college, and she had a hyperreflexia and kicked me right in the groin, so I haven't done it since then.
I'm going to test your reflexes. If you could just let your arms be loose and by your side. Just let your arms just drop down. Very good. Okay, just let your legs be nice and loose. And test your ankles.
What I'm going to do now is gently check your reflexes, if that's okay.
Yeah, fine.
What I want you to do is relax your leg down on my arm and let me take the weight of it. Okay? And relax and let me take the weight. Thank you. And relax the leg down, and the same on the other side.
Yeah.
Thank you. Thank you. And let me take the weight. That's great. Thank you. Good. On the count of 3, can you clench your teeth together for me?
Yeah.
Thank you very much. 1, 2, 3. Thank you. That's great. Nice and relaxed with the ankle now for me. On the count of 3, clench your teeth for me. 1, 2, 3. And again, 1, 2, 3. Thank you. And the same with this foot. Nice and relaxed for me. On the count of 3, clench your teeth. 1, 2, 3. 1, 2, 3. Thank you very much.
And so starting with the biceps reflex. And some people don't have the briskest of reflexes. Just relax there. And to bring it out, I can feel it there. I can feel the muscle. Can you clench your jaw? Clench your jaw hard. And that tends to bring it up a bit more. Good. And then the brachioradialis is here. Great. There. Great. And then the triceps. And there's a few ways to do the triceps. I'll do this arm first. Okay. And just let it drop down like that. Which doesn't always work for some people. Other ways, just let your arm drop, please. Let me hold it up. Good. Okay. There we go. Now I'm feeling it a bit better. There we go. Good. So the two main reflexes are, of course, the patella. Okay. And although you could tell his reflexes are a little brisker in the lower compared to the upper, but that's fine. It's just more if they're asymmetric. And then moving down here, lifting his leg up for the Achilles. And that's good. I'll move over here. And it's good. And then what we can also do is the Babinski, where we actually scrape this at the bottom. And we're just going to scrape it along there. And he retracts a bit, but he doesn't do the positive response, which is the toe going up.
First thing I'm going to do, I'm going to test over here. Okay. Okay. Just leave your hand right here. Okay. Come over on this side. Okay. Put you right here. And just leave your hand here. Okay, that's perfect. Let me check your knees. Okay. Get your Achilles. Alright.
And then bend your knees up a bit. Same amount on each side. Okay, put that leg down. Bend this one, that's it. Let it flop towards me. Same on the other side.
Her reflexes are +2 equal and active. Okay, just relax that. There you go. There we go. Good. Yep. Okay, yeah, there you go. Oops. There we go. That's it. Her upper and lower Motor reflexes are +2 equal and active.
So I'm going to be using this. It's called a tendon hammer. I'm going to be I'm going to be tapping this at various muscles. It shouldn't feel, you shouldn't feel any pain. But if it's uncomfortable, please let me know. You might just feel a sort of tingling sensation. So if you could just completely relax for me, and then you could just fold this across your lap like that. Okay, be tapping it. Okay, that's fine. And if you could just fold this across, again, just completely relax for me. Okay, that's fine. And if you could, I'm just going to be tapping your forearm as well. So again, just completely relax for me. Okay, that's fine. And just here. Okay, that's fine. And I'm just going to be hitting the back of your arm as well. So if you could just let me take the weight of your arm. Okay, that's fine. Can you just clench your teeth, and I'll count down to 3, and then I'll tap. So clench your teeth when I say 3. 1, 2, 3. Okay, that's great. I'll do the same again here. Okay, that's fine.
I want to put my hand underneath like this. Just going to lift your legs up. Okay, thank you. Same with the other leg. Okay, thank you very much. And now, can I ask you to cross your leg? Sorry. Are you okay? Okay, that's all right. I'm just going to tap over here. Okay, same with the other leg now. Okay, thank you very much.
Open your jaw slightly for me. I'm just going to be tapping this lightly with this tendon hammer here. If you feel any pain, please let me know. So we just... Okay, that's brilliant.
I'm now going to test your reflexes. Allow me to position your arms like so. I'm going to begin by testing your biceps reflex. Now we'll move on to testing the knee reflexes. And finally, the ankle reflexes.
Now I'm going to check the reflexes, okay? It's not going to hurt it. Bend your arm slightly. Thank you.
And I'm going to test your reflexes. So again, really nice and relaxed and floppy. I'll take the weight of your leg. Just get you to clench your teeth for me. Just clench your teeth. Okay, all right, thank you.
Can you clench your teeth together tightly for me? That's marvellous. And now relax your jaw open and let your mouth hang open a little floppy. That's it. Don't force it out though, forward moves. That's it, lovely, nice and relaxed. Thank you.
Let's take a look at your reflexes here. You just try to relax. Relax. Okay.
So with you sitting there, I'm just going to tap your arms. Okay, so if you go nice and loose for me. Okay, and go nice and loose on this side, lovely. Okay, if I could get you to swing your legs around for me. So next thing we're going to do, I'm just going to test your reflex. That's all right. So 1, 2, 3. 1, 2, 3. There we go. And 1, 2, 3. Okay, that's lovely. Get you to kneel on the bed like so. We're just going to test your ankle reflexes now, so stay nice and relaxed for me. That's lovely, thank you.
So I'll
start on the left and then we'll go to the right, okay? First we're gonna check. Go ahead and relax and I'll hold your arm here. I'm just gonna hit my hand. Okay. And you're gonna see your bicep. See how it flinches there? Okay. Tricep flinch. And brachioradialis makes your thumb jump. Okay. Good bicep reflex. Good tricep reflex. I don't know if you can see that from over there. But watch how much your tricep jumps. See how it jumps right there? Alright. You can tell that you work out. And good brachioradialis. Okay, next we're going to do your knees. Okay. This is your patellar. Have you had any problems with knee injuries? Nope. Okay. Go actually scoot your butt back a little bit because we're going to have your legs kind of dangling. Okay? Good. Very good. Well, this part I apologize, may tickle a little bit. I just want to see. Okay. Must not tickle at all. It doesn't.
Check your reflexes here now. You just relax that. There you go. Oh, there's a problem.
Is it really there?
No, I'm just kidding. We like to play around here, have fun, especially after hours. Okay, relax your leg. There you go. This is why I don't stand out in front of people and leave. Okay, just let your ankle relax. There you go. Good. Just let it relax. I got it. There you go. Better.
You just put your hands down. Drop your elbows. Let them go loose. And I want you to clench your teeth for me and let them go loose. Same on this side, clench your teeth and let them go loose.
And then the reflexes. I tend to do the reflexes now when he's nice and relaxed, even though the textbooks will tell you do power next, but I already know about power because I've just examined him walking. So we compare the sides. Again, ideally we'd expose the muscles so that we can see them, but certainly the reflexes are normal. Just relax your leg. There we go. Just relax it. Again, a bit on the brisk side because it's a Saturday morning and he's being examined on camera when he'd rather be at home watching the telly. Is that true?
They're always brisk.
They're always brisk, okay. And then let's not forget the planters. Little scratch coming now. Okay. Do that one again? Okay.
I just need to do your reflexes, if that's okay.
Yeah.
Gently tapping you with a hammer. What I want you to do for me is rest your leg down on my arm. That's it. And let me take the weight of it. Relax it down and let me take the weight. Thank you. Thank you very much. And the same on this side. Again, let me take the weight. That's fantastic. Thank you very much. I'm just going to hit my own hand now. Thank you. And relax your foot for me, nice and floppy. Just let me gently hold it back. Thank you. And the same on this side. And gently hold it back. Thank you. This is a little piece of plastic, just going to along the bottom of your foot. Okay?
Okay.
Thank you. Okay, thank you very much.
Scoot back just a little bit so your shoes aren't quite out. There you go. Perfect. Just like that, nice and loose. Okay, good. Now, stare at the edge of that picture and don't blink as I tap your forehead just with my finger. keep staring there. Okay, now, here, feel this first, Pat. It's a little bit, it's not sharp, but it's rough, right? I'm going to stroke your palm like that. Look at that. Don't pay any attention to what I'm doing. Same thing here. Same thing here. Okay, good. Now, I'm going to tap my finger. Just let your jaw hang. Just like that. Perfect. Okay, very good.
Just relax. Just let your arms go loose. The triceps, again, just all floppy. That's super. Just let your legs go all floppy. And just flop your legs out. It's like a rectangle, that's the bottom of the rectangle, that's the top of the rectangle. That's the top of the rectangle, that's the bottom of the rectangle. That's fine.
So I'm just going to test your reflexes now. So I still want you to go lovely and floppy, and I'm just going to use this. It doesn't hurt. So try and relax. Okay. Same the other side. Okay, and relax. Brilliant.
Okay. I'm just going to tap on some of your joints now, so if you just stay nice and relaxed, let me take all the weight. Good. Can I ask you just to clasp your hands together for me? And when I say pull, just pull together. So relax and pull. And relax and pull. Just relax to begin with. And when I say pull, pull. Pull. And this side. Relax to begin with. Pull. And relax.
So I'm going to take some of your reflexes now. Okay? If you could just put your arm like this. And this. Great. Lift this up. Thank you. In here. Lift this up. Here. Okay. Now I'm going to do to your knees. Right behind your ankle. Great.
So we do muscle tests and also reflexes, upper and lower. He's had x-rays taken and hasn't had any recent trauma. He's under regular chiropractic care, so I'm not going to do a full-blown comprehensive exam on him. But I do always examine patients according to their needs. Reflexes are +2 equal and active, upper and lower.
I'm going to check your reflexes. So just relax. Relax.
And then directly strike the Achilles tendon. That's actually quite an awkward technique, and just as effective is to place your palm on the sole of the foot and strike it that way. And that also gives you the advantage of the angle of swing. That's an unnatural swing. That is a natural swing. It's easier to do. So the plantar strike is perfectly legitimate as a way of getting an ankle jerk. And again, for older people that maybe have arthritic knees or arthritic hips, getting their foot into this sort of position to do an ankle reflex is actually quite difficult and potentially uncomfortable. For the knees, you want to put your hand under the knee so you're supporting the weight of the knee, end of tendon hammer, patellar tendon there, and if you hold the tendon hammer along the length of the leg, you're probably going to get your target, and you want a good swing up, swing down. Same again, weight of the legs, again your hands down towards the ankle, so that the tendon hammer is usually about the length of an adult lower limb. Bring it up, bring it down. Just like that, let the tendon hammer do its work. If you do this sort of thing, there's no acceleration, the reflex doesn't work. In the lower limb, the difficulty with the lower limb is getting to these tricep reflexes. So what you want to do actually, so you've got the radial head there, your brachioradialis tendon attaches there. You want to put 2 fingers just proximal to the radial head, and again look how high the tendon hammer is going, let the hammer fall. And you see there's a contraction there and the hand makes a supination. Then on the other side you want to kind of compare like with like again. Usually a watch is in the way, but again there's my fingers on the brachioradialis tendon, hammer falling from a height. You want to locate the biceps tendon with your thumb, put pressure on it, and again height, let the hammer fall. This one's quite awkward because you've got to reach across the patient, palpate the biceps tendon with your thumb, and again let the hammer fall. To get the triceps then, just bring the arms across now. That's the trick. You've now created plenty of space for the reflex, and again see the angle there, see how much movement there, hammer, and again here, see how much range of movement, hammer, you get the reflex. The other reflex sometimes done in the upper limb is called the finger flexion reflex. If you take the weight of someone's fingers and then just tap under, you sometimes will get a bit of a contraction that you can usually feel rather than see. And Hoffman's sign they talk about, which is a sign of hyperreflexia. You just sort of try and flick the distal phalanx, and what you see in Hoffman's is the thumb will flicken when you do that, and it's a sign of hyperreflexia as well.
Can you please let your arms relax in your lap? I'm going to test the biceps reflexes. Brachioradialis. Triceps reflex. Let your arm relax. Patellar tendon reflexes. And Achilles tendon reflexes. Drawing it straight from the heel along the sole of the foot in an arcing motion towards the toes, and observe the first movement at the proximal joint of the great toe. The normal response is flexion. Extension is the abnormal response, also called the Babinski sign.
Okay, so just have your arm relaxed. I'm sorry. Great. Great. Perfect. Just relax. Okay. Okay. Perfect. Okay. Stand on the side for this one. Okay. Great.
Next we're going to percuss.
let me know if any of this hurts, okay? Alright, no pain there?
No.
Alright, next we're going to check for CVA tenderness. I'm going to do the same thing, and I want you to tell me if you feel any pain, okay? Just relax your arm on mine. There you go. Okay, and the other side. Alright, both tricep reflexes are equal on both sides. Next we'll move into the brachial. So just relax your arm right there for me. Alright, and this side. Alright. Brachial reflexes are equal on both sides as well. And we will go ahead and move into the radial. And radial reflexes are equal bilaterally as well. It's kind of listen for any differentiating sounds. Any pain whenever I do this? Good reflexes there, equal on both sides. And now for the Achilles, just gonna hold your foot here. All right, and this side. All right. Equal reactions on both sides of the Achilles. Both her feet tended to go down whenever I struck her Achilles.
Just stay your arm, relax your arm. Just need you to relax your arm. Excellent. Okay. Just gonna hold your arm out like this. Okay. Just need you to relax your leg.
So first your brachioradialis. So can you relax your arm for me? That's C5 and C6, and relax. And the bicep C5, C6. Alright, I'm going to do your triceps, C6, C7, C8. Alright, patellar, I'll push this in. this is L2, L3, L4. Okay, and Achilles S1, S2. And plantar, which is S1, S2, L4, L5.
I'm going to lift this up just a little bit. Good. Can you move your arm just a little bit? Perfect. Thank you. Okay. Your aorta was also very strong when I was listening. Okay, I'm going to hold your arm right here. I'm going to do your biceps. Okay, good. I'm going to do your tricep. Okay, great. I'm going to do the patellar and, okay, great. And I'm going to do the tibial. Okay, great.
It's important that when you're doing C7, the patient is completely relaxed, you're looking straight ahead, letting this arm really just kind of hang there. Now, if they're apprehensive, I might, ask them questions about where they're from and what they're doing these days and that type of thing. So I have her relax. I want to strike her right above or proximal to the olecranon, okay, on the tricep tendon. So relax that arm, let it be super heavy. Okay, good. And we got a nice C7 reflex. Notice she's a little hyperreflexive, okay? So we're going to keep that in mind and look at other neurologic testing, but we're not going to go there yet today. When we do the biceps, I have them rest the forearm on my forearm. I put my thumb on the bicep tendon. Now relax your arm, let it be really heavy. I take the sharp part of the reflex hammer and I strike. And so she is hyperreflexive. Now she has had cervical spine surgery. About how long ago?
18 months.
About 18 months, okay. So, she has the same hyperreflexia on both sides. Now we're going to do C6, brachioradialis, and there's our reflex right there. Now, let's talk about the hammer. There are cheap hammers out there that are really, really light that don't allow you to build enough momentum before it strikes the patient. And if it's too soft, does not cause the tendon to stretch enough. Okay, so I love this type of hammer right here. It's nice and heavy, so the heavier the better. Okay, and then when you do it, it's a nice strike. Now because we're going across the tendon, I use the wide side here. When I'm trying to aim for a tight spot, I use the sharp side. Hammer should be heavy enough. When you do your test, it's a nice strike, and it should bounce off of the patient. Right at the patella tendon, this is L4. And then when we do the Achilles, that's S1. I try to get the patient to relax a little bit. I pull the toe up lightly, and I'll strike the Achilles tendon. And there's a good one, okay? Now, if the patient is hyperreflexive, I'm going to take the patient's shoe off and do a Babinski test. And I'm also going to do a Hoffman's test. If she's hyperreflexive here and hyperreflexive in the upper extremity, some people just are hyperreflexive. But if they have a positive Hoffman's test,
and a positive Babinski sign, which I'll be doing how-tos on soon, you have to be somewhat suspicious of an upper motor neuron lesion. So, if I'm not, or if you're not able to get a good Achilles reflex, and many people have a hard time with that because the patient doesn't relax very well and they try to hold the foot up, I will then place them on a chair. So, Vicky, if I could have you over here. You're going to put both knees on the chair, you hold onto the back, and now they really don't know when you're going to be striking them, okay? And then I'll just hold the toe a little bit and I'll give a strike, and they can never really fight this one. And you can see right there, we get a really nice reflex.
I'm going to go ahead and test the deep tendon reflexes. I just want you to relax. I want to test the brachial and the tricuspid. And the brachioradialis. Oh, sorry. Now to the left side. Sorry. Okay, and okay, excellent. Go ahead and test the tendon reflexes of the lower extremities, patellar, and the Achilles. I got one out of the left. Two. And the Babinski.
Ooh, that tickles.
Okay. Okay.
So now I'm just going to check your reflexes. Alright, your patellar. Alright, your reflexes are symmetric and 2+. Now your Achilles. Alright, also symmetric and 2+. Alright, we have your, we're going to start with your tibial. This way, okay? Alright, we got your tibial and we got your brachial. If you could do that. Okay, good. Those are both 2+ and symmetric.
So in the lower limbs, again, you can do this with the patient seated. So let your legs dangle there, okay? So that's a knee reflex. I would usually just come down. Now again, if you're sitting, nice big swing, and you get the tendon reflex. I hope you haven't been injuring your knee there, okay? You could also just support the knee like that, tendon hammer like this. There's the patellar tendon there. Nice firm strike. Again, nice firm strike. If you do this sort of thing, you're not going to get a tendon reflex, okay? The ankle jerk, when you're doing the ankle jerk, just bring your toes up hard as you can. This tendon here is your tibialis anterior tendon, okay? Now if that tendon is contracted and I try and do an ankle reflex, nothing happened because that's the antagonist of the Achilles tendon. So what you've got to do is relax the ankle, and really without letting the patient know you're doing it, you want to gently put a bit of tension in the Achilles tendon, and then again let your hammer swing to get the reflex. It's also perfectly legitimate to do a plantar strike, where you put your fingers at the sole of the foot, slowly stretch the Achilles tendon, and then smack the reflex like that. Because that does the same thing, it creates the acceleration force in the Achilles tendon muscle spindles that generate the reflex. Same again here, so again you can passively dorsiflex the foot. I used to say the tibialis anterior tendon is the enemy of the ankle jerk, so it doesn't really work if the foot's actively dorsiflex. If you passively dorsiflex and strike, you get an ankle jerk. So that's how you do the ankle and knee reflexes.
Steps elicit each reflex by striking the tendon in the crease of the elbow, looking at the bicep muscle to see the reflex. At the wrist, strike the radial side of the wrist, approximately 2 fingers width proximal to the wrist joint, to elicit the supinator reflex. At the triceps, strike the tendon above the elbow at the back of the arm while looking at the triceps muscle for the reflex. Ensure that you are holding the tendon hammer correctly and that you swing it in a pendulum-like motion to elicit each reflex at all times. You can test the reflex at the knee while the patient is seated or while supporting the patient's leg if they are supine. Strike the patella tendon just below the patella with the tendon hammer to elicit the reflex. An alternative way to test the ankle reflex is shown here, as the foot is slightly dorsiflexed and the sole of the foot is then struck to elicit the reflex. Conduct the Babinski test to check plantar response. If the patient's toes flex, this is normal. The test is considered positive if the great toe extends and the other toes flex or spread apart. Reinforcing upper limb reflexes. To reinforce reflexes for the upper limbs, you may ask the patient to clench their teeth or to squeeze an object in the contralateral hand while eliciting the reflex. Reinforcing lower limb reflexes. To reinforce reflexes for the lower limbs, you may ask the patient to clasp their hands together and pull when eliciting the reflex.
Is they'll tap on your knee and they're looking for, did you see the little motion from Bob's foot? Okay, that's the reflex response, okay? What's going on is when I hit the tendon between the patella and the tibia, it causes the quadricep muscles to briefly contract, okay? So we can do the reflex test here. You can do it on this tendon here, is very common as well. You can do it on, you put the arm like this on the tricep, and we can do it here. We can do it on the bicep here. We can do it brachioradialis. And there's a number of spots you can do the reflex. And what we're looking for is actually in the nervous system to give us some information as far as is the nervous system responding appropriately. Is it hyperactive? Is it hypoactive? And that's what we're looking for. It gets very complicated as far as the nervous system, so we don't want to get into that, but that's what the hammer is for, and those are the various locations you can use a reflex hammer for. Thank you.
Test the biceps reflex with the patient's arm in her lap. Palpate the biceps tendon with your thumb and strike your thumb, not the tendon itself. Look for flexion of the forearm. Test the triceps reflex with the patient's elbow held suspended in your hand. Encourage her to let the arm hang limp. Palpate the triceps tendon with your thumb and strike your thumb. Look for extension of the forearm. Test the brachioradialis reflex with the patient's arm in her lap. Palpate the brachioradialis tendon with your finger and strike your finger. Look for contraction of the muscle, sometimes with upward angulation of the hand. Test the patellar reflex with the patient sitting on the edge of the bed. Palpate the patella and the patellar tendon below it. Strike the tendon directly or tap over your thumb. Look for extension of the lower leg. Reinforcement may help when reflexes are hard to elicit. Have the patient clench her hands together and pull hard while you test the reflex. Test the ankle jerk reflex with the patient sitting on the edge of the bed. Tap the Achilles tendon with the hammer and look for foot flexion. If you place your hand underneath the foot, you may feel subtle flexion that cannot be seen. It may be easier to elicit this reflex with the patient kneeling on a chair. If the patient can't sit, lower extremity reflexes can be tested with the patient supine. Test the jaw jerk or mandibular reflex by placing your finger or thumb on the chin and tapping it. Look and feel for slight jaw contraction. Test for the palmomental reflex by scraping the thenar eminence with the end of your reflex hammer. Look for contraction of jaw muscles or twitching of the lip. Test the plantar response by scraping along the lateral border of the sole and across the toes with the end of the reflex hammer. Extension of the great toe, called the extensor plantar response or Babinski sign, is abnormal. Withdrawal or toe flexion is normal. The Chaddock and Oppenheim reflexes look for the same extensor response, but are less likely to cause withdrawal. For the Chaddock reflex, the stimulus is a scrape along the side of the foot from the lateral malleolus to the toes.